So now I'm really pleased to get to talk to someone who works with an organization that has done so much in central rural Missouri, focused on these types of issues and how do we create a community that works for everyone and that meets everyone's needs. So Kayla Schmidt is the director of operations with the HCC Network, and like we normally do, we'll just kind of have a conversation. Next slide, please. So the first question is if anyone has any questions, as we think about things, but we'll kind of start by letting Kayla introduce herself and talk a little bit about HCC Network, which sorry, that should have been updated. They've changed their name. So really, what brought your partners together and what have been some of the ways that you've worked to better meet the needs of your communities?
Hello. So as Robert said, I'm Kayla. I'm our Director of Operations at HCC Network. I have been with the company for 5 years, and so I work mostly on the programmatic side and with all of our federal and state funding. So I get to do a lot of the fun stuff, the innovative stuff, but HCC Network is a federally qualified health center in Missouri. We have 6 locations. One of them is dental only. And so we have Carrollton, Buckner, Concordia, Lexington, Waverly, and Independence. We have medical, dental, and behavioral health in every location, minus Independence, because that's only dental. And then we also co-locate with Burrell Behavioral Health in a couple of our locations. Every one of our locations have a community health worker, and then we do have a couple peer coaches. In addition to our standalone clinics, we also have 2 mobile units. And so one of them serves primarily dental, and then one of them is medical and behavioral health. Um, so kind of the concept where HCC came about was originally the community was working on projects like walking trails, greenhouses, food storage for the schools. All of those things were identified on the community needs assessment. So as those things were getting implemented, the need for affordable access to care continued to be an unmet need, which prompted HCC to open our clinic in Waverly, which was our first clinic. Um, the original board members were the For Life Center, which is located in Lexington. We had our local health department. We had the Migrant Farm Workers Project, Pathways, or it's now known as Compass, and then Lafayette Regional Hospital. And so we've grown immensely. We actually opened a clinic during COVID 2020. And so since then, since I've been with HCC, we've opened 2 clinics and added 2 mobile units. And so our growth is crazy big. But our CEO as well as our leadership and all of our staff are huge advocates for bringing people together to meet the needs of our community.
So what was it about the needs of the community that brought so many different partners together to kind of start the network that then eventually led to starting a clinic at Federal Qualified Health Center?
So I think, so I wasn't here in the very beginning. So
Sure, of
what
course.
I what I've understood is that we have the word network in our name. And so if it doesn't necessarily scream that we're a healthcare clinic. And so originally we were truly a network. We had and we still have a 7,500 square foot warehouse where we have hygiene items. We used to have DME. We did furniture at one time, but all of that was free to the community and all of it was donated to us. And so I think it was just our leverage of our memberships. Um, we noticed healthcare was in need in all of our locations. Um, we truly leveraged the community needs assessment and then to build our community of where we're at now. Our Waverly Clinic was actually gifted to us by, it used to be a critical access hospital. And that's how we started. And then we eventually grew to Concordia and so forth. I think Tony Ann Richard is our CEO. She's a phenomenal person. She can build partnerships like nobody I've ever seen. Um, and so she is truly an advocate for healthcare. She grew up in rural Kansas, and so she has been able to see the needs firsthand. Um, and so I think just initiating conversations and truly evaluating the needs. Obviously, we can't fix everything, but if we can look for funding sources, if we can build consortium, or if we can continue to build on our network, then it's benefiting everybody.
So when you work every day with people, um, how do you think economics, jobs, poverty, income, how does that really impact ability, both the people's individual ability to get their needs met and to be successful, but also even the success of the community itself?
It's tough. I think,
Yeah, I only ask the hard questions.
yeah, yeah. Um, we truly believe that financials are affecting everything. We've seen a shift in the past 2, 3 years, that people financially need help than they ever have before. We've seen a huge need in transportation, and essentially it just trickles down. And so, if someone doesn't have transportation, they can't get to their healthcare appointment. If they can't afford their healthcare appointment, chances are they're probably not going to show up. Which is why we've kind of implemented um, our dental and mobile or medical outreach teams, um, to meet the person where they're at. And so our outreach team is phenomenal. I know one of them is on this call. I'm not going to call her out. Um, but they are a fantastic team. They have grown our outreach program tremendously. Um, and I think it's truly about meeting people where they're at. With our outreach program, there are a multitude of services that are grant funded, whether that be through federal funding or state funding. And so those are somewhat specific, especially our school-based funding. Um, but I think we're truly all about meeting the patient where they're at, especially in these times. We will transport a person to an appointment. We will show up to the school, and do a full day of dental work. And so financials are tough, but which is, I mean, it's also why we've kind of geared towards that CHW model. They're able to do the food stamp applications and the Medicaid applications, and um, they're truly for the patient.
So you referenced working with schools a little bit. Tell me a little bit about that and why do you think it's important in your community to kind of engage and work with and support schools?
So some history on our school-based program is that prior to 2020, we had we had two community health workers actually located inside a school. And so those were per HRSA school-based sites. Um, since then, we kind of altered our model a little bit. And now we just take our mobile units to the schools. Um, we offer sports physicals. Those are offered throughout the year, primarily in spring and fall, just because that's when the kiddos need physicals. Due to some funding, those are um, no cost to the student, which is a huge benefit. And the parent doesn't have to take off work, or they don't have to worry about getting them to their appointment or whatever that may be. We also have had a really successful dental outreach program in our schools. It's still growing every year. Like I mentioned, our outreach team is working on getting into another county and expansion on that. Um, there they do a full dental appointment. And so we have a dentist on the unit. We have a hygienist and assistants on the unit as well. Um, I will say that um, the enrollment for those kind of ebbs and flows. We we used to have a couple schools who we knew that we could fill a full day plus some, and now it's kind of shifted a little bit. And so I'll talk about that challenge and the advice for partnership a little bit later, or in the next few questions.
Sure. Yeah,
Um,
so let's talk first, and you've gotten into this a little bit, but let's talk first about in your daily work, working in your community, all the great things you guys do to get services into your community and go where the people are. What do you think, what are the important issues that you see that are sort of impacting and affecting kids and families in your community?
Um, I would say we're seeing a huge need for transportation. I would say overall, just overall financials, affecting their overall health. So if they're unable to pay for dental work, if they're unable to get a physical, um, we've seen a huge shift in vaccination rates, which I'm sure is across the country. Um, we're also seeing a lot of like food insecurity. And so I would say in housing, um, truly all the social determinants of health. Um, but I would say transportation, housing, and just financials are probably our top three. Because we're an FQHC, we do the sliding fee scale. And so that is a helpful to patients. Um, and we also have the grant funding to back if it aligns with the funding source.
So you mentioned school physicals, and I just thought that it's great, sports physicals, because, in hearing what Evelyn talked about and some of the other things, this idea of opportunities and having sort of someone who supports and builds on them, sometimes I've always thought that some of the kids that would most benefit from activities like sports have things like not being able to get their physical that stand in the way. So I was really excited to hear how you're able to do that. So, you talked a little bit just before we kind of move on to talk about partnership and what's important about that. Do you see other issues of income or poverty? Do you think this drives a lot of what you see as needs in your community or even the success of the community, the communities that you serve?
I would say the biggest thing that probably impacts is just continuity of care. Um, Sometimes we are seen as an urgent care type of facility, um, which at the end of the day affects our UDS numbers. But we are we've worked really hard over the past couple of years and few years to figure out how to retain a patient and retain a service. And so
Hmm.
if financials or transportation or housing is affecting someone getting into an appointment, they're not going to show up. And so I think specifically for us as an FQHC, I would say patient retention and just that continuity of care is where we see it affected the most.
So you have a long history as a successful partnership. You're one of the only, if not the only, rural health network, sort of or network of organizations that came together to work on health issues in your community that then decided to start an FQHC. So it's not common. In fact, it may not even ever have happened elsewhere. It didn't, as far as I know, it's never happened elsewhere. It used to be the only one where a network of community groups came together and started an FQHC
Mhm.
through what's called the rural health network process. So pretty exciting. And you guys are really good. And the reason why we wanted you to kind of come today is you're just so good at serving your community, but also really responding to and being part of and listening and, kind of responding to what the community says because you were founded by the community. So, really kind of interested as you've looked at partnerships and as a community provider of services, what kind of challenges do you face and what do you think is important to overcoming them? You mentioned your school districts and some of the decline in uh, kids signing up or parents and families having their children get the services available.
I would say staffing turnover, which shouldn't be a surprise. I would say that's both internally with HCC Network employees as well as our community partner employees. Um, it can be very difficult to change. I know our outreach team has changed numerous times just because it's a difficult program at HCC. Um, and I think that leads to relationship building is hard work. It's not just one phone call, it's not just one meeting, and everything is good to go and you don't have to talk again. It is truly remaining consistent in efforts. Um, I think how we've overcame them, I think we have, I think we've been consistent. Um, we have HCC has not had a significant amount of turnover. The person leading our outreach team has been with HCC longer than I have, and so she is very well known and very well respected in our communities. Um, and she's gonna love me for saying this. She's stubborn. She is the type of person where she will get things done. She will build those relationships. And she's not afraid to jump in whenever things get hard or whenever we've heard no. Um, Also, I think we're also at a space with our outreach of kind of like what's next? Where can we continue to build and grow? And that can also be difficult as well. I know um, over the past couple years, we have tried really, really hard to market HCC and get our name out there in the community, especially since we rebranded. Um, and so I feel like the organizations who we've partnered with thus far, they're kind of like, okay, we get it. We know who you are now. It's getting the additional partners and additional organizations to come together and kind of buy into our model um, in what we do. And I think that whenever organizations are able to see the successes and the impact on whether it's their students or their patients or their clientele, they're like, all right, we're on board. But it's all about consistency and that relationship building, which isn't easy.
So you kind of touched on this, but kind of finish up, just what's your biggest piece of advice when it comes to partnerships across the community, including partnerships with schools, but kind of how do you bring everybody together um, as you work on community needs?
Oh, um, I would say no doesn't mean no forever. Um, if we were told no 2 years ago, that doesn't mean that we'll get told no today. Um, I would continue to advocate so hard for the individuals that you're working with and the services that you provide. What we're doing and what everybody is doing isn't easy work. It's very difficult, it's very taxing. But I think growing that network of community partners is so, so important. It's so vital to everyone's role and everyone's livelihood. Um, that just to continue to advocate so hard.
Keep with it, be stubborn, right?
Yeah, be stubborn.
Well, thank you so much. It's
For
been
sure.
great. And HCC Network is, really a national model for how communities come together and meet healthcare needs and meet the needs of their communities. I really appreciate you being able to join us today.
Absolutely.
Christy, I
Thank
think
you for having me.